You know, when we think about the health of a massive health insurance company, what the industry calls managed care, we almost always look straight at the financial bottom line, right? We're talking revenues, profit margins, stock prices. But how do we measure their true underlying health and those hidden risks? How do we actually evaluate their preparedness for things like major cyber threats, changing regulations, or even a shifting global climate? Well, welcome to this explainer. Today, we're going to look way beyond the traditional balance sheet to uncover exactly how the biggest players in healthcare are being evaluated on their long-term sustainability.
Okay, let's dive right in. The framework we are unpacking today comes straight from the SASB standards. You can think of the SASB standards, which are now managed by the IFRS Foundation, as essentially the ultimate standardized corporate health checkup. The International Sustainability Standards Board uses these highly specific metrics to help investors and regulators figure out the non-financial risks and opportunities that could drastically affect a managed care entity's cash flows. And we're talking short, medium, and long term.
So here's our roadmap for today. We're going to be evaluating 5 key pillars: customer privacy, access to coverage, plan performance, improved outcomes, and finally, climate impacts.
All right, kicking things off with Pillar 1, Customer Privacy and Technology Standards.
Look, we live in an era of totally digitized medical records. Because of that, managed care entities are guarding massive amounts of sensitive data, which means they are facing the immense, high-stakes risk of cyber attacks. But it's absolutely crucial to remember that these companies aren't just guarding your name or your home address. They are guarding your personal health data. This is deeply personal information related to your physical or mental health that reveals your actual health status. Failing to protect this specific data doesn't just hurt a company's brand, it triggers massive civil and criminal penalties under jurisdictional laws. It's a huge deal.
And SASB standardizes this risk by essentially making companies say, "Show me the money." They have to disclose not just the raw number of data breaches they've had, but the total hard dollar amount lost to fines, civil judgments, and settlements. It puts a very real, undeniable price tag on poor cybersecurity, forcing these entities to show exactly how much their failures are costing them in hard currency.
Moving right along to Pillar 2, access to coverage and ensuring actual care.
So here we get into a metric called the medical loss ratio, or MLR. Simply put, it asks, for every single dollar you pay in premiums, what exact percentage is actually being spent on your real medical care versus just padding administrative costs or corporate profits? SASB requires companies to publicly disclose this percentage of total healthcare insurance premiums that are spent directly on medical claims, as well as efforts to improve the quality of care.
But here's the kicker. They absolutely cannot hide behind one blended generic average. No way. SASB forces companies to cleanly disaggregate this ratio across small employers, large employers, and individual retail segments. That way, we know exactly who is getting the most value for their healthcare dollar. This level of granular transparency ensures companies are actually delivering accessible coverage fairly across the board.
Let's shift gears to Pillar 3, Plan Performance and Evaluating Quality.
If these companies want to prove they are genuinely keeping customers happy and maintaining their market competitiveness, they have to open the books on some very specific performance metrics. For example, they must report on enrollee retention rates. I mean, are people staying with the plan or are they fleeing? They also have to track grievance rates. This means literally every single oral or written complaint filed against them expressing dissatisfaction with how the entity provides healthcare services. Then, we hit what's probably the ultimate stress test for any patient: denied claims. The standard smartly splits this into 2 categories. First, pre-authorization denials, which is being told you can't get a surgery up front because they deem it medically unnecessary. And second, denials at the time of payment, which is being hit with a massive bill after you've already received care. Tracking how many of these denials are appealed and ultimately reversed reveals a lot about how accurately and fairly the company actually processes claims to begin with.
All right, on to Pillar 4, Improved Outcomes, focusing strictly on enrollee health.
Believe it or not, insurers actually have a very real financial stake in you eating your broccoli. They are required to track the percentage of enrollees participating in wellness programs. We're talking everything from diet and exercise to stress management, mental health, and smoking cessation. These programs strongly encourage primary and secondary disease prevention. So why does this matter so much? Because, quite frankly, healthier enrollees mean much lower claims costs down the road, which protects both the patient's lifespan and the company's long-term enterprise value. It's a win-win.
And finally, we arrive at Pillar 5, Climate Impacts on Human Health.
This one is honestly fascinating and probably the most surprising forward-looking metric we'll look at today. Think about the chain reaction here. As extreme weather events increase globally, illnesses and diseases begin to migrate, which directly drives up unexpected encounters with the healthcare system. Insurers have to prove they are actively factoring this planetary shift into their financial projections. They need to discuss exactly how it impacts projected revenue, costs, and their incredibly complex risk assessment models.
And SASB gets incredibly specific here. They demand reporting on the geographical migration of tropical diseases, things like malaria and dengue fever, moving into previously safe non-tropical zones. They also track increases in waterborne diseases like cholera, following natural disasters, and even malnutrition from decreased food availability. This effectively takes the massive macro threat of global climate change and brings it right down to the human-level illnesses that insurers are literally going to have to pay to treat.
Which leaves us with a really critical question to end on. We've seen how managed care entities are graded on protecting our sensitive data, ensuring our premium dollars actually go toward real care, maintaining fair claims processes, and keeping us well. But as the entire planet shifts, are the healthcare industry's risk models truly prepared for the changing geographical incidence of diseases? The SASB standards make it abundantly clear that sustainability in healthcare is about so much more than just a balanced budget. It's about anticipating the future of human health itself. Thank you so much for joining me for this explainer, and I really hope this gives you a completely new lens through which to view the managed care industry.